Welcome to Lesson 11. In this lesson, we will study ICD-10-CM Chapter 7 Diseases of the Eye and Adnexa, coded from H00 to H59. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Lesson objectives. By the end of this lesson, you will be able to correctly assign glaucoma codes from category H40. Apply laterality and stage rules accurately. Code bilateral glaucoma in different scenarios. Distinguish indeterminate stage from unspecified stage. Apply the highest stage rule for inpatient cases. Correctly code blindness and low vision using category H54. Chapter 7 Exam Importance. Chapter 7 coding requires very careful reading. One small detail like right eye versus left eye, or same stage versus different stage, can completely change the code. In CPC exams, glaucoma questions are often scenario-based, so accuracy is critical. Glaucoma coding overview. Glaucoma codes must capture three elements: type of glaucoma, which eye is affected, stage of glaucoma, reported with a seventh character. If all three are documented, all three must be coded. General rule for assigning glaucoma codes. You may assign as many codes from category H40 as needed to fully describe the condition. Always review documentation in this order. First, identify the type of glaucoma. Second, identify the affected eye. Third, identify the stage. Missing any one of these can lead to an incorrect code. Glaucoma stages. Seventh character. Glaucoma stages are reported using the seventh character. 0 means unspecified stage. 1 means mild stage. 2 means moderate stage. 3 means severe stage. 4 means indeterminate stage. The stage must be clearly documented by the provider. Bilateral glaucoma. Same type and same stage. If a patient has glaucoma in both eyes, the same type, the same stage, and the ICD-10-CM classification provides a bilateral code, then assign only one bilateral code, using the correct seventh character for the stage. Do not code each eye separately in this case. Bilateral glaucoma. No bilateral code available. Some subcategories, such as H40.10 and H40.20, do not provide bilateral codes. If both eyes are affected, same type, same stage, then assign one code only, with the appropriate seventh character for stage. Bilateral glaucoma. Different type or different stage. If a patient has bilateral glaucoma and each eye has a different type, or each eye has a different stage, and the classification distinguishes laterality, then assign separate codes for each eye. Each eye must be coded individually. Bilateral glaucoma. No laterality distinction. If both eyes are affected, each eye has a different type of glaucoma, and the classification does not distinguish laterality, then assign one code for each type of glaucoma, with the appropriate seventh character for stage. Same type, different stage, no laterality. If both eyes have the same type of glaucoma, but different stages, and laterality is not distinguished, then assign two codes, one code for each documented stage. This is a very common CPC exam scenario. Glaucoma stage progression. Inpatient rule. If a patient is admitted with glaucoma and the stage progresses during the admission, you must assign only one code, representing the highest stage documented during the stay. Always code the worst stage. Indeterminate versus unspecified stage. This distinction is critical. Indeterminate stage seventh character, 4, means the stage cannot be clinically determined. Unspecified stage seventh character, 0, means the provider did not document the stage. These two are not the same and should never be confused. Common glaucoma coding errors. Avoid these mistakes. Coding both eyes when a bilateral code exists. Forgetting the seventh character. Confusing indeterminate with unspecified. Assigning two eye codes when the type and stage are the same. Blindness and visual loss overview. Category H54 is used to code blindness, low vision, visual loss. Coding depends on whether one or both eyes are affected, whether the visual impairment category is documented. Blindness or low vision, both eyes. If documentation states blindness or low vision, both eyes, but the visual impairment category is not documented, assign H54.3 unqualified visual loss, both eyes. Blindness or low vision, one eye. If documentation states blindness or low vision, one eye only, visual impairment category is not documented, assign a code from H54.6 for unqualified visual loss, one eye. Blindness without eye specification. If documentation states blindness or visual loss, but does not specify one or both eyes, assign H54.7 unspecified visual loss. Never assume laterality. Blindness coding summary. Remember, both eyes, no category right pointing arrow H54.3. One eye, no category right pointing arrow H54.6. Eye not specified right pointing arrow H54.7. CPC exam traps, blindness. Common mistakes include assuming the visual impairment category, coding bilateral when laterality is not documented, using unspecified when the affected eye is clearly stated. Quick exam recall. Lesson 11, glaucoma coding requires type plus eye plus stage. Same type and stage right pointing arrow 1 bilateral code. Different type or stage right pointing arrow separate codes. Inpatient cases right pointing arrow highest stage wins. Indeterminate does not equal unspecified. Blindness codes depend on eye documentation. Student coding approach. For every eye-related case, ask, which eye is affected? Is it the same or different type? Is the stage the same or different? Is a bilateral code available? Is the stage clearly documented? This checklist prevents errors. Practice tip. Always read ophthalmology notes line by line. Small words like bilateral, progressed, or indeterminate can completely change the code.